Peace. Good morning. Morning, good morning. Peace, peace, peace. How are you? How are you? Welcome to 420 Fellowship. It's cold outside. Um, what I want to do is kind of start out same way I started out last week with a little humor with this guy. Where is he? Come on, fella. Actually, let's start out with the normal thing, man. How y'all doing today? What is everybody smoking on? What are you smoking on today? What would that be? Um, right now. Hey, hey, sis. That's my beautiful sister, Laura. That's not my beautiful sister, Laura. That's my beautiful sister, Ruby. Hi, Laura. What are y'all smoking on right now? I'm smoking on some, this is actually a very special blend. This is, Durban Poison. And if you know anything about Durban Poison, hey, Rubes. Naturally Beauty. Hello, wave, wave. So, Durban Poison is it's a pure sativa. Now, most of the sativas and most of the indicas and most of the strains have been mixed some kind of way through the years. But this is a pure sativa Durban Poison. Comes from Wave out in Greenbelt. So it's a very good, very good. Just woke up. Thank you, sis. Um, last week we started with this guy here. I just want you to watch this because it's funny. Now, some people smoke for a sacrament. Not me. I'm on a purpose. All right, let me get off of that. Okay, Laura, what's sativa? What are you smoking? What is it? What's the blend or the brand? Okay. Another thing that we talked about before was counting your blessings. That's a segment that we want to get into a little more. Um, and that can mean anything that happened to you today, yesterday, last year, 5 years ago. But just counting your blessings. Hey, Christelle. Um, just giving thanks, just counting your blessings. Sometimes I think we don't do that enough. Sometimes I think we just kind of complain a lot. I'm talking about myself too. I'm always talking about myself when I'm talking, actually. But counting your blessings sometimes I think just to remind you of some of the good things. One time I did a show and the show got cut off. Very good. Okay, mine is very good too. This Durban Poison. Christelle, what are you smoking on? We just was figuring it out. I just was talking about this Durban Poison. But when I talk about counting your blessings, I'm talking about well, what I was saying before. I had a show that got cut off, and I had to start over. But I've been on many trips, many places in different places around the world. I've been about 10 or 11 different countries. I've been to 5 different countries in Africa. I've been to the Caribbean. I've been on the road to church. All right. I've been to a lot of places in America. So I just, all of them been blessings. Some of them I went to free. I went to Costa Rica for free. I went to Angola for free. People blessed me. So I've been blessed. So count your blessings. Leave your blessings somewhere you've been blessed. Leave it in the comments. Count your blessings, people. That's what that's about. Um, so I'm going to get started today with what we normally get started with, which is the book. Now, as you all know, this book is 420 God's Bible. That's what we go from. It's a daily. So we're on day 7 right now. This is the 7th episode, and then on week 7, we're on day 7 of the book. And on day 7, we're gonna go with we're gonna start with what that assessment is. Boom. Okay. So it says, good morning, Shay Nana. We're on day 7 right now. So it starts with sympathy stares. Oh, it's cold out here, by the way. Looking for a new location, preferably indoors. Sympathy stares. Now, I kind of well, let me read the whole thing first, and then I'll break it down line by line. Okay. Sympathy stares. Ego less. Hey, Shannon. And then there's a graphic. Now that graphic, I tried to make it similar to the graphic that's in the book, but it's that graphic is to give you a thing to look inward. Ego less. Dive in. Divinity is my destiny, not by chance, and north of is. Two soul, zero, two soul O, spirits came. Together, four cell, perfection. No mystery. Misery is. Now let's break that one down. So we all go through our thing. We're gonna go through something. We're gonna go through a loss, a death loss, a job loss, a love loss, and we're going to feel horrible. And that's where the sympathy stares come in. Somebody's going to look at you, you're going to look at them, you're going to want sympathy, they're going to give you sympathy, and you're going to need it and want it. And then there's going to be times when you're just off on your own, looking for sympathy or looking at sympathy. And at some point you're going to realize that everybody kind of has to go through it. You know, we all go through the shits. All of us are going to go through something that's going to make us question our everything, question our faith, question our existence, question our reason. Why me? You know, you're going to have that happen to you. That's part of life. All of us. All of us going to think that something happened to me that was worse than it happened to all of us, but it ain't. Because all of us got our oh shoot. All of us got our cross to bear. Hold on a second. Um and that's when you're ego less. That's when you have to take your ego out of it, bring yourself back, and realize that you part of it, all of it. So this journey and this trip is going to be a journey that you're going to have to um take yourself and take your ego and leave it at the door because it's not going to help you in the long run. You're going to go through some tough times. You're going to go through some tough everything. We all go through it, but you got to let go of your personal ego. And we realize we all connected, all of us connected. We all connected through our joys and our pains, our ups and our downs. And you love and treat each other how you want to be treated, then that'll bring good morning, Kim. That's our guest. That'll bring this healing. But it take you, me, us, less ego. I want sympathy. I am in trouble. I am hurting. I'm in pain. Why me? Take your ego out of it. Why all of us? And then try to sympathize with somebody else who went through something. Ask somebody about something that happened to them and see if they went through something that you went through, or probably worse than you went through. And you'll find out that somebody went through something worse than you did. I bet you that. Dive in. Go deep in the knowledge. This is dive in. Divinity is my destiny. You can't hear me at all? Can anybody hear me? I'm, I see that Kim can't hear. I'm sorry. If y'all can hear me, let me know. I'm sitting here talking for a long time. Can anybody hear me? Okay. I don't know, Kim. Let me know. You might have to reconnect. Um, so dive in. Go deep in the knowledge that you are. Dive in. Divinity is my destiny. Not by chance and north of is. Go deep in the knowledge that you are a product and child, recipient, reciprocator of the divine element. There are no two ways about it. Peace, peace, my brother, my man Short, DJ Short. There's no two ways about that. Not by chance and north of is. Um, Now let me talk about is real quick, because is the third person of be, and be means to exist or to occur or to take place. Am is the first person of be. So the is the existence. The is the what it is, and my destiny is north of that, north of that, and that comes from the knowledge of divinity, the knowledge of knowing my divine purpose. That that puts me at a level. When you understand that level of divinity, you start out at you get to cloud nine. That's where you at, and I'm north of that. I'm on cloud 11. I can teach y'all how to get there. That's later on in the lessons. But what I'm saying is that when you have that knowledge, your destiny and your divinity is God given. So I'm gonna break down the other part. Two cells, two souls, zero spirits came together for cell perfection. Two souls, two people, zero spirits, two perfect cells came. That's how y'all came together. Those two cells made four cells for perfection. Not a mystery. That's not a mystery how that happened. All right. So every birth that was put here is a divine birth. Every person that made it here in a divine way, through divinity's choice, through divinity's path, through how you got here. Everybody don't make it here. Every soul don't make it here. But when those two cells came together and they formed four cells, and those perfect cells formed 8 to 16 to 32, and so forth and so on, the misery, every birth is a divine gift. It's not miserable. It's divine. So the misery is as well. The misery is. It's the same is. It's the same be. It's the same state of being. It's the same choice. Just like that choice when those two came together. When you two came, was there misery in that? No, it was divine. And it's still divine. Understand that divineness. Understand your divineness. Understand the divinity that you were born with. And be that. And be that as it may, and be that what it is. We're going to get right into our guest. I hope you can hear me, Kim. Let me try to bring you in and see. Okay, can you hear me?
Yes, I can hear
All
you.
right, cool. I gotta change this thing. One of the things I'm trying to get better at is working this graphics, because I have them up for too long sometimes. All right, good morning.
Good morning. Good morning.
How are you today?
I'm doing fantastic. How are you?
I'm freezing.
It's a beautiful day.
It
Beautiful
is. It
Sunday.
is. It really is.
Mm-hmm.
It wasn't. It was like 30 degrees warmer last Sunday. So
Mm-hmm.
I'm trying to adjust. But anyway, so Cam, let's just start off. Just introduce yourself for everybody here, and tell them who you are, your name, what you do, and we'll just start from there.
Okay. My name is Kim Farley. I am a registered dental hygienist. I've been a hygienist for over 30 years.
Mm,
Don't tell anybody that. That's a secret.
I don't believe you.
Um, uh, and I have always been on the quest to find different things about oral health, and I've always been interested in cannabis, and I know how cannabis has, well, I've theorized how cannabis worked for other people. So I wanted to take my love for oral health and my love for cannabis and combine the two. So I created a business that is called Oral Health and Wellness Learning. And it's a business that helps to bridge the gap between cannabis and cannabis users and oral health. And so that the two can understand each other and be able to communicate with each other because as far as a healthcare provider standpoint, if you really don't understand what somebody is going through, then it's harder to help them. So I want to be able to help oral health care providers to understand who's using cannabis and why they're using it, the results of their use, so that they can, tell them how to stay healthy, just like they would if they were taking Xanax or anything else. We're going to have to be able to do the same thing with our cannabis community, and also for the cannabis community to understand how to take care of their health and be an advocate for them and just bring them education. So that's what I do in a nutshell. And I also created a product, which is a CBD product.
Okay.
And I
What's it called?
wanted to, it's called the Oral Spritzer.
Hmm.
And it's a full spectrum hemp oil that you squirt underneath your tongue. And the tongue is the fastest rapid take up for cannabis. So if you're using tinctures, make sure you put it under your tongue. But the one of the benefits of cannabis is that it's an anti-inflammatory. So to me, it made sense that a lot of issues that happen in the mouth are due to inflammation,
Hmm.
which are also due to dry mouth. I'm
Hmm.
kind of big on hydration, trying to stay hydrated.
Hmm.
Um, and so I wanted to combine the two and figure out a way to, very good, I like that, to combine the two and help people understand how to take care of their oral health. And using the oral spritzer and using CBD is really helpful.
So what's the actual name of the, is it called oral spritzer, or is that the name, or is it an oral spritzer? What's the actual name of the product?
The actual name of the product is the oral spritzer.
Okay.
Excuse me. hmm And my company is Oral Health and Wellness Learning.
I want to.
And mhm.
I'm going to try to pin that oral health and wellness learning. Okay, go ahead. I'm listening.
and I wanted to, just have something that it combines the two things that I love so much, and I'm really proud of it. And I believe in both, and I know the benefits, how one affects the other, big time. Is your mouth is the gateway to your health.
Hmm.
So if your mouth is not healthy, then the rest of your body is going to be problematic. So it's really important that you take care of your mouth. And so, and I also know the benefits of how cannabis has helped so many. So it was almost a no-brainer for me to figure out how to tie the two
Combine the two.
together. hmm
How were you introduced to cannabis? When like, and be honest.
Okay, I'm gonna
I
be
was 11,
really honest.
and
I was
so
12.
okay. Well, I didn't start. I didn't become habitual at 11, but that was my first time with these little white boys. But go ahead. What was your
Yeah,
first?
right, right. So I was 12. I'm the youngest of eight.
Okay.
So I have siblings that I would find marijuana around here and there. And I was pretty knowledgeable about it. I would see how people behave. And actually, a lot of my friends around that same age were experimenting with cannabis.
Hmm.
So I found a pipe, found a little marijuana, and
Where'd you find the marijuana?
let's see,
You said you found it, like it was just
I
sitting there.
found it. I found it. So my dad used to have a pool table. We used to have a basement, and he used to have pool table parties.
Hmm.
And there was a refrigerator down there that had like an open space.
Hmm.
It wasn't like fleshed with the woodwork.
Hmm.
And I just happened to see it up there. I saw something in a bag that looked a little strange, so I pulled it out. I knew exactly what it was. Oh, this is marijuana.
My
I'm
turn.
keeping this because it wasn't like anybody was gonna be like, well, where's my marijuana? Who took
Right.
my marijuana? So I held on to it for a little while, and me and one of my girlfriends smoked it. And I don't remember getting high. I don't really remember probably getting high until I was maybe 15.
Okay.
but, but yeah, my first experience was when I was about 12 and
Okay.
was in my father's basement by his pool table.
So okay, obviously it didn't stop your track, and that's the thing I think that you and I talked about before was normalizing cannabis amongst people who have been ostracized or had to kind of for a lot of their lives kind of keep it in the closet because
Right.
you were looked at as a drug addict. But
Mm-hmm.
you are a dental hygienist.
Mm-hmm.
Obviously, you went to school. You had to go. Where
Mm-hmm.
did you go to school, by the way, if you don't mind asking?
I'm from New York. I'm from Ithaca. I went to school in Syracuse. I
Okay.
went to Onondaga Community College to get my dental hygiene degree, and then I went to Syracuse University for a little while. Then I moved around a little bit, but ended up in DC
Hmm.
and went to UDC, got my bachelor's in health education,
Hmm.
and then I went to Nova Southeastern to get my master's in leadership and healthcare. So not
Cannabis never
really,
stopped you.
never. I no, and and it actually probably helped in a lot of instances. Of course, I feel, that cannabis has the ability to help very many scenarios, takes the edge off and things like that. So when I went back for my master's degree, I started to maybe midway through started to tie in marijuana. Living in DC, things were changing in DC, and I, was going to courses, continuing ed courses about cannabis, and everybody was saying is, just tell your patients don't smoke. It's
Hmm.
bad for them. It's going to cause, dry mouth, oral cancer, excuse me. So I said, well, are there any benefits to cannabis?
Hmm.
Sorry, one second.
Hmm.
And they said pretty much no.
Hmm.
So of course, I didn't believe that. I knew better. So I used cannabis in any course in any way that I possibly could
Hmm.
so I can learn more about it and I can speak really from a healthcare perspective.
Hmm.
I'm sorry. And that's what I did.
Hmm.
So when it was time for me to write my final paper to graduate, you had to get permission when you're writing a thesis.
Hmm.
And I wanted to talk about cannabis and the dental hygienist and how to educate patients. I was told that, interesting enough, I was told, how did I get this far writing this way? They respectfully recommend that I drop the course. This is my second to last course. And I'm like, we're not dropping nothing. And I suggested that we had to have a conversation.
Hmm.
And after the conversation, she was like, "Oh my goodness, you thought about getting your doctorates, and you should come to, you could come and speak to the health department." And I was like, "Okay, can I just write the paper?"
Hmm.
So wrote the paper. She was really impressed, and it was a really great experience for me because it really put in motion for me to continue down that path and
Hmm.
talk about oral health and cannabis and
Hmm.
talk to
Ow!
people in a not oh
I'm listening.
in a non judgmental and non biased atmosphere. So
Okay.
I've been really happy to do that, and I really first, I would say initially it was a little risky
Mm-hmm. Uh,
tying in cannabis to oral health because
mhm.
people had just had such a stigma
Right.
about cannabis and oral health, especially in the dental community. It's really conservative. It's
Right.
very, very conservative.
I can imagine.
So, in many different ways.
Mm-hmm.
So
Mm-hmm.
that was even more challenging. But I've been around the block. I'm older. I don't really care that much about what people think about what I'm doing. Especially if I know and I believe in it.
Mm-hmm.
So I just continue down the path and um, keep on moving forward with it.
I put up a graphic with this CBD one.
Hmm.
It's about the cannabinoid system.
The en-
Cannabinoid.
the endocannabinoid system.
Yes. Can you speak on that any? Do you have any expertise in it, or can you just
I
kind of
have
give some
some,
frame?
yeah, I have some knowledge. I have some knowledge with this. So the CBD, CB1 and CB2, your body has this system called the endocannabinoid system,
Hmm.
and it's a system of receptors that are looking for cannabinoids. So there are two main parts. There's the part that's in your central nervous system,
Hmm.
and that's where CB1 is mostly found, but not exclusively. And then there is the CB2, which is in your gut or in your inflammatory area system. So what it's doing is it's looking for receptors.
Hmm.
So these receptors are found all over your body,
Hmm.
and CB1 stands for cannabinoids. So when you hear CBD, CBD actually stands for cannabinoids. So this cannabinoid 1 receptors are mainly in your central nervous system, and then the cannabinoid 2 are mainly in your gut. So the cannabinoid 2 is related to inflammation, and inflammation related, a pain that's related to inflammation, like arthritis or inflammation, gingivitis. When it gets to a certain level, it hurts. And then the CB1, which is in your brain mostly, is related to different levels of pain and things like that. So we make CB cannabinoids. Our body makes it naturally, but
Hmm.
guess what else makes it? The plant.
Hmm. Hmm.
So
How
you
about
have
that?
hemp, and you have marijuana plant. And they
Hmm.
both make CB. They both make CB1, CB2. They make CBN, they CBGs. There's so many different compounds,
Hmm.
but these compounds are known to. So what the endocannabinoid system does,
Hmm.
it is looking to promote harmony and balance in your body.
Mm.
So the THC, which is a cannabinoid,
Hmm.
and the CBD, CB1 and CB2, which are cannabinoids,
Hmm.
once it floods in your body, it goes to these different places. That's why people talk about how marijuana is good with pain,
Hmm.
and a lot of people that have cancer have used it for pain,
Hmm.
or people that have chronic pain, because it does really help to promote that balance throughout your body.
Hmm.
So these systems are really important for. It's a system that hasn't really been studied
Study.
that
Hmm.
much,
Hmm.
maybe the last 15, 20 years or so. And a lot of medical programs don't even talk about it. So finding this information on my own was helpful to be able to bring this to light.
And you know what's amazing is that while you were talking, I was just going through these slides.
Hmm.
Um, and everything that you were saying was like on point. I'll quiz you. I told you I was gonna quiz you, but you passed it by because I was just like I had actually downloaded these slides I think yesterday, and I was just gonna bring them up. But while you were talking about them, um, they were everything you were saying was going through the slides that I had downloaded. So there's one still up there now with the CBD
Hmm.
one too. But and I'm glad that you could give us that knowledge because I think that 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 system that's in our bodies, um, in our four cell perfection bodies,
Hmm.
was predetermined, right? That system was already there before we got here. And then I think what happens with people um, I had a discussion with somebody who told me that they don't smoke and they just don't get it. And he said like everybody he knows like 11 people of his buddies that smoke, and him and another guy just don't, and he just doesn't. And I said I understand that as well. And I was like you at one point too. You know, I didn't get it. I think I was looking to get high. I used to drink and I would smoke my friends, and I was like, I don't get what you're saying. Like it don't mean nothing. And then once I guess relaxed, and I kind of let the medicine kind of just do what it needs to do, just like any medicine. Like if you take a shot of morphine, well, morphine kind of works pretty quick, but there's some pain medicines that you can take, and you might be in pain for another hour or so until it kicks in, and then it kicks in.
Mm-hmm.
You say, okay, it's working now, and it's the
Mm-hmm.
same. It was the same kind of thing I think with cannabis for me. Learning later to just kind of relax and not look for something, and then relax, and then I learned to enjoy it. I actually didn't start smoking regularly until I got into my 30s, my early 30s. So, you know. Now I want to ask you some more questions about dentistry.
Okay.
What are ways? Okay, let me ask you about the different practices or different levels of dentistry. Like, so what are they like? A dentist. What's the difference between a dentist and an orthodontist? And well, give me those two first. What's the difference between a dentist and an orthodontist?
So first of all, a dentist has to be an orthodontist. That's the foundation for all these doctors that are related to stuff that's going on in your mouth. So an orthodontist is a dentist that specializes in orthodontia, which is straightening of the teeth and your bite and things like that.
Hmm.
So that's what an orthodontist does. There's an endodontist. An endodontist is the one that you go to if you need to have a root canal.
Hmm.
He specializes in the nerve of the tooth. There's an oral surgeon, and he basically does that, oral surgeries. They also do implants, which can kind of be considered an oral surgeon. Anytime that you're going into the tissue, that's
Hmm.
considered, an oral surgery. So, and that's an oral surgeon. You have a periodontist that specializes in the periodontium, which is the foundation of of your teeth, the bone that the roots of your teeth
Hmm.
um, sit in. Let's see, who else? What else is there? I think that's kind of it for the most part. I'm probably missing somebody. Somebody.
Okay, so now
Um,
the person who like when I go to the dentist and I get my teeth cleaned and I get a checkup and she tells me I need to get my teeth pulled, I will go to the oral surgeon for that.
right.
Does an oral surgeon also do cleanings and checkups, or do they just strictly do, or is that like another level? Like an oral surgeon is a little higher level than the person who does the cleaning and the checkups, or
Well, first of all, there's no such thing as a cleaning. So I know that everybody, I know you probably heard that, all your
what
life
am I
that you're going to get a
what are they
cleaning. You're going to get
charging
a
me for then?
cleaning.
Say something
So
up
you're
there.
not actually getting a cleaning. The dental hygienist is the one that does what you consider a cleaning. We don't do cleanings. We treat disease. So
Hmm.
most people have some form of disease. So a
Hmm.
hygienist is the one. She is a or he or she is a healthcare provider that should collaborate and work as a almost as a partner with their dentist and work together. And then there's a dental assistant. Dental assistant is the one that assists the dentist. And when you go in and get your fillings and things like that,
Hmm.
then that's who the dental assistant is. The hygienist is the one that gives you oral care.
Hmm.
And
Is that like
then
scraping the plaque and everything?
Mm-hmm.
Okay.
Mm-hmm. Yeah. And that really it's bacteria. And all
Hmm.
that bacteria does is cause disease. So anytime you have bleeding
Hmm.
on any level, that's some form of disease. I'm sorry,
Okay.
that's some form of bacteria infection, not disease.
Okay.
So we help to facilitate a healthy oral mouth. We really work as prevention specialists,
Hmm.
where dentists and oral surgeons are more restorative,
Hmm.
more they are more reactive and
Hmm.
we're more
Pro.
proactive.
I got you.
Hmm.
So now I had my I guess my hygienist told me that I should get my wisdom teeth pulled because I think
Hmm.
they're cavities. I don't have any pain, but there's cavities on them,
Hmm.
and I don't want to get my teeth pulled because I I want my teeth.
Yeah,
I mean,
we're really, connected to our teeth.
attached to
I
them, and
get it.
attached to my
Yeah.
gums. They're part of me. But I mean, like, and I mean, I'm listening to her, but I'm like, I'm not in any pain. And she says this is like
Right.
the third time I went over the last 18 months, and I got to go again in December. I'm sure she's gonna tell me again. You need to get your teeth pulled. So
Hmm.
should I get them pulled?
Well, if your hygienist, now see, the hygienist, remember, we're more proactive. So what she's trying to do is prevent you from having any problems, even though you've actually had them since you're an infant, but they've probably been in since you're in your maybe late teens, early 20s. But if she's telling you that they need to be taken out and they're decayed, then that's
Hmm.
a problem. You may not ever feel pain. It may
Hmm.
kill the nerve of the tooth silently,
Hmm.
but then you still have that festering bacteria that's
Hmm.
living around the tooth, which goes through your system.
Hmm.
So your mouth is directly correlated to your overall health.
Hmm.
So if you have decay and it's leaching through your system, then you're actually leaching bacteria into, your bloodstream, which, goes through your whole body. So it's probably a good idea to get them out.
But when you take it out, wouldn't that leave? If you leave a hole, doesn't that leave a area for bacteria to go into? Like if there's a hole now where a tooth was removed, or am I
The
getting that wrong?
whole
I don't know.
No, no, no. There's a possibility of what's called a dry socket, but it doesn't stay that way. As long as you follow, if you go to an oral surgeon, you may have to actually have it sutured.
Hmm.
And sometimes what they do is they give you sutures that dissolve. So it's, kind of fine. Um, but even if they don't do that,
Hmm.
that area will close up. And the mouth is the fastest healing place in the whole body. So as long as you follow instructions, you really shouldn't have any problems. But I would tell you that you should not smoke.
Who
You
would tell
should
me that?
not. You should not smoke. If you get your teeth extracted, pulled,
Mhm.
no smoking for a couple
Ever?
days, for
Oh,
a few days.
wait a
Well, I know ever you can be like, no, I'm never taking them out.
minute. Ever? Hey, hey, hey! What kind of surgery is this? Um. Okay. Wow. Yeah. Okay. So I guess I mean I've been just kind of just putting it off because just my teeth. I want to keep all my
Hmm.
teeth, even though
Hmm.
I have some issues. Um.
Well, you could do tinctures. Part of the problem is when you have anything extracted in your mouth, it's the pulling. So if you're smoking, right, and you're the sucking, that
Mhm.
motion can actually pull the blood clot out of the area. And that's how it starts to heal. So you pull a tooth, then a clot starts to form in that space, and that's your body, trying to work its magic and close that space. But if you suck, a cigarette,
Mhm.
a J, a straw,
Mhm.
anything like that, we don't even want you to suck your saliva and spit out. We don't
Mhm.
even want you to spit out because if you think about it, when you spit, you pull
Mhm.
and then spit, right?
Mhm.
So you wouldn't even be able to do that. You would, have to let it kind of drizzle
Drool
out
out.
or,
Mhm.
yeah, yeah, because you don't want to pull that clot out.
Keep my teeth for a little while.
You don't want to pull that, but the chances of there, if you have decay in the wisdom teeth,
It's not. She says
um,
it's a cavity. Is that the case?
that's
Is that the same
yes,
thing? Okay.
it's the same thing. Yeah, it's
Okay.
it's going to lead to, it's inevitable that you're going to have a problem if you don't do anything
More.
about it.
Right.
It's
Okay.
definitely
I'll
inevitable.
get it for it. So let me ask you
And
now.
typically
Oh, go.
we'll say, I'm sorry, typically we'll say, if the other tooth is problematic or if it's impacted, or we see that you may have something going on, then they're going to recommend getting them all out. It just makes sense to get them all out. So
Oh man.
I know that's a lot. That's a lot.
Yeah, I know. I'm actually getting long in the tooth. I can see. I don't want to show.
Hmm.
One of my teeth, this one is my gum is, I guess, is receding, but I can see my tooth looks longer than it did 10 years ago.
Hmm.
It's getting very horsey. Um, let me ask you now, what going back, let's go back to on the spiritual side.
Hmm.
How did you let me how did you grow up spiritually? Like did you grow up in church? Did you grow up Muslim, Christian, Jewish? Did you grow up agnostic? And and where are you now in your spiritual journey?
I grew up in the church. My mom was a stewardess in AME Zion, actually. And that was all my childhood. And when I became an adult, I still went to church here and there, but not as much, a young adult.
Hmm.
Then I joined a Baptist church when I moved to Virginia. And now being in DC, I find that people talk about spirituality. I feel like my connection with God is more a one-on-one
Hmm.
connection. So I see God in everything. I look for God in nature, and I pray,
Hmm.
and so my spirituality continues to evolve, but because of my foundation, I know who whose I am
Hmm.
and what I am as I continue to keep my spiritual journey going.
And I asked that because I think one of the things that people who are cannabis uh, consumers, I think that there's been sort of this kind of disconnect with the church per se, because there are people who are churchy who just they just can't do that, and I point to the Bible and herbs and everything else that's put here for us, and going back to even the cannabis cannabinoids.
The
That
system, the,
yes, the system that's born in us. You know what I mean? So I don't see anything wrong, and the healing properties, everything about the cannabis plant medicinally, even the uses of hemp. You know
right,
the different things that you can do with it from just from industrial standpoint. Everything that it's just a plant that's very useful, and
right,
we shouldn't
right.
pretend like we don't need it because we do.
Exactly. And in reality, the hemp plant is probably more valuable than the marijuana plant,
Hmm.
you know, and it's been used for
Hmm.
thousands of years, so it makes sense that it's connected to us.
Hmm. Um, Now let me ask you as far as with cannabis and keeping your breath fresh and what are the best practices to do to make sure that you have a healthy breath and healthy mouth and being as a cannabis user, what are the best things? I know you said stay hydrated. Also, real quick, let me see. I wanted to talk to you about your videos as well that you put out because I know that you put out about 5 or 6 videos on different oral health topics. So can you just touch on some of those and some of the things that cannabis users can do to keep a healthy cannabis mouth?
Yes, yes, indeed. So I'm gonna say that using cannabis in any form is gonna cause, well, we all know the cotton mouth. Even, you do edibles, they all cause cotton mouth, and that is a precursor to issues with your mouth.
Hmm.
So it's really, I talk about hydration and how important hydration is, because if you are not producing the right type of saliva, then that saliva actually could encourage problems with the mouth. So definitely staying hydrated, it is critical,
Hmm.
and making sure that you're going in between your teeth with something. Floss is, really important. I use
Pause. Go ahead.
Let's see. Do I have some goodies over here? I do have some stuff. Um, Yes, you want to go in between your teeth with something.
Mm-hmm.
I used to tell my patients to floss the teeth you want to keep. So whatever teeth you want, but it doesn't necessarily have to be floss every single time.
Mm-hmm.
Floss is important because it helps to where the teeth touch. So, and it also helps the tissue.
Mm-hmm.
But you could use a water pick.
Mm-hmm.
You could use these little interdental brushes. And let me see if I have one of those. Um, and different types of floss. But I want to make sure people use stuff that's easy so they're more likely to do it.
Mm-hmm.
So, um,
See that? See her
yes,
gums
your
bleed
gums,
when she floss.
yes, yes, my dear, your gums bleed when you floss because you don't floss enough.
Mm.
So I guarantee you, if you get in there and you floss regularly, the bleeding will stop. Also, though, if there's some gum issues going on, you may need to go see a hygienist just to get yourself a fresh, clean slate and then be able to manage. But typically, if you're pretty good with your home care and you're flossing pretty regularly, or getting in between your teeth regularly, your gums won't bleed because healthy gums don't bleed. So
Mm-hmm.
we want to get to that point because if you thought about if you brushed your arm or you scratched your arm and your arm bled, you'd be like for real concerned about that,
Mm-hmm.
even if it didn't hurt.
Mm-hmm.
So when you go in and you floss and it doesn't hurt, but your gums bleed, you should still have that same concern because that's definitely a problem.
Mm-hmm.
So I know I digressed a little bit, but that's part of some of the things that I talk about on my videos
Mm-hmm.
is keeping your breath fresh and healthy. Hydration is critical. Going in between your teeth is critical. And let me see if I have a couple of different brushes. Using a power toothbrush is very good.
Mm-hmm.
I have a couple brushes here. This one is Sonicare.
Mm-hmm.
Get a little close. And this one is Oral-B. They're both brushes that sit in a charger. But right now I'm on my Burst, and I should have grabbed that. I love my Burst. I love my Burst. It's a really cool toothbrush that's ultrasound,
Mm-hmm.
just like the Sonicare. So it moves really quickly, but it's really soft and feathery and it gives you this pause in between 30 seconds. So you know 30 seconds here, 30 seconds
Mm-hmm.
here, 30, 30, and it shuts off.
What's the name of
Um,
that one?
it's called Burst.
Okay.
Now, I'm getting ready to be a Burst ambassador. So y'all hold on, please. I would like for you to get it through a professional.
Well,
You'll get
everybody,
it.
yeah,
You'll get it.
follow. Everybody, follow Kim, and make sure that we do promote and see
Yeah.
you.
I appreciate that. And I am really impressed with this toothbrush because it was created by hygienists. So you want to
Mm-hmm.
stay hydrated. You want to go in between your teeth with something. Invest in a good toothbrush.
Mm-hmm.
And it can be, I'm looking for a brush that's more um, reducing of your carbon footprint
Mm-hmm.
and more in tune to what's going on with our planet here.
Mm-hmm.
So the burst is leading the pack. The other
Okay.
good thing about the burst is that it stays charged for 4 weeks. So
Okay.
if you charge it, you're good to go.
Boom. Go
So
out the
those are
country.
things. Yeah, right. We going out. I ain't going out the country. Uh, let me
Philly, 2AZ asked the question, what's the best brush, soft, medium, or hard?
always soft.
Okay.
Even you want to look for a sensitive, extra, ultra soft. Medium and hard toothbrushes actually cause damage, and it
Okay.
does permanent, irreversible damage. Always want to use soft. Even a soft toothbrush, if you're scrubbing with that
Mm-hmm.
soft toothbrush, you can do damage to what that does is it causes the gums to recede, and
Mm-hmm.
then you get
See?
these little notches. You get these little notches in the sides of your teeth.
Mm-hmm.
So definitely always super, super soft. Softer the
Okay.
better.
Okay. I'm glad you told me. That was a
Yeah.
great question. I never knew that. Wow. I'm glad you told me.
Yeah, it's
That's
really
that's good to
important.
know. Yeah.
And we used to have those hard toothbrushes because we felt like they did, they were doing
We're
it was
cleaning them.
scrubbing,
Yeah. You're like, yeah,
scrubbing.
I'm really getting it clean.
Yeah, but you're actually scrubbing. I mean, there's some patients that have these little notches in the sides of their teeth that I can actually I could like pull on it with
Mm-hmm.
my fingernail when I show them with gloves on, of course,
Mm-hmm.
but pull on it to show them how deep. And then what happens is you keep those toothbrush bristles keep going in there, and funnel and make that groove deeper. And guess what happens?
Mm.
You could actually kill the nerve of the tooth and need a root canal
Mm.
by brushing too hard. So
Mm-hmm.
soft
Be careful.
toothbrush, ultra
Okay.
soft toothbrush. If you have electric toothbrush, let it do the work.
Mm-hmm.
But y'all gonna love this burst. Oh, I love this toothbrush. I
All
love
right.
it.
I remember that burst. We're gonna definitely promote it and
Yeah.
pump it on our page as well when you get your representative. We had another question from the weed district. Should you avoid toothpaste with fluoride?
So, this is a tricky question, because as a professional, I've always been taught about how important fluoride is. However, you don't always need to brush with fluoride, but you have to make sure that you're doing the right things by, brushing at least 2 times a day, maybe even 3 times a day. You got to stay away from acid. Acid is in everything. We got kombuchas, which I love, lemon water, things like that, sparkling waters, seltzer waters, sports drinks, um, coffee. These are all things that have acid in it. And if you don't have anything to protect your teeth,
Hmm.
then you're going to end up with some problems.
So does
So
the fluoride help block the acid?
what the fluoride does is it helps to strengthen the tooth.
Hmm.
So it does help to fight against decay. It helps to fight against acid erosion, sugar. These are things that are problematic to the teeth. And, you're supposed to keep your teeth. You're not supposed to ever lose your teeth. Your teeth are
Hmm.
supposed to go with you.
Hmm.
Not when you get older, you automatically lose teeth. No.
Hmm.
Um, and trust me, the stuff I've seen with people that haven't taken care of their teeth, and they all say the same things. They all say that I wish, I had taken care of my teeth. I wish I, had listened.
Hmm.
So I would say, I do use fluoride toothpaste. I don't use it all the time.
Okay.
I,
Now,
mi- I I mix it up.
is it poisonous? I've heard that's the there's the reports about fluoride being poisonous and fluoride having these I've heard poison that it was created by Nazis or something. I don't know. I just heard a whole bunch of different things about
Yeah.
fluoride being dangerous and not good
Mhm.
for us. So is
Mhm.
there a danger or a risk? And they also say don't swallow toothpaste as well. So is
Yeah, you
there a
don't want to swallow
danger?
toothpaste.
Right. I mean,
Don't
is that
swallow
because it's fluoride or is it because it's just toothpaste? Is it like can
It's
you
a
keep?
there's a lot of stuff in there, but
Okay.
fluoride occurs naturally as well.
Hmm.
You can find it in natural spring waters. Some fish have fluoride in it naturally, and things like that. So, and it can be a poison,
Okay.
but also, not to not for nothing, but you don't want to do anything in excess. It could be, problematic. So I grew up on well water. I didn't have fluoride in my water. And I
Hmm.
didn't have any issues with my teeth, but I also went to the dentist regularly as a
Hmm.
child and, was looked after as a
Hmm.
child. So you want to, yeah, like I said, I don't use fluoride toothpaste all the time,
Hmm.
because I'm of that theory as well that, less
Hmm.
is more.
Hmm.
But I also do many things to make sure that I take care of my mouth, and water is definitely number one.
You said something earlier about the carbon footprint, and I just bought this toothpaste the other day from I think it was from Giant, but it's a carbon um toothpaste. It's black and it's supposed to whiten your teeth. It's yeah, it's
Oh,
carbon
charcoal?
charcoal. Yeah, I said carbon
Mm-hmm.
charcoal. But
Mm-hmm.
it looks like it's been working actually. Like I've only been using it for a couple of days, but my teeth seem to be white. I don't know if it's psychosomatic, but it seems like it's working. Is that a good product to use? Charcoal.
Charcoal's another thing that's been around for thousands of years.
Mhm.
And there supposedly is no medical research that shows the benefits, but for something that's been around for thousands of years,
Mhm.
yeah, it does work. I mean, and the cool thing about this birth toothbrush, the bristles are carbon. They have not
Mhm.
carbon. They have charcoal in the bristles, so I find that it's helpful. My concern is making sure that you don't use anything that's abrasive,
Mhm. Mhm.
regularly. So you
Mhm.
want to just kind of switch things up.
Mm-hmm.
Maybe
Mm-hmm.
use something, use the charcoal. And if you bought it in
Orthopedics.
toothpaste, I'm sure it doesn't have, honestly, it probably, and it may be black or dark in color, but I
Mm-hmm.
guarantee you it doesn't have a lot of charcoal in it.
Okay.
I don't think it has a lot of charcoal in it. So it's probably okay
Mm-hmm.
to use. I've seen charcoal at like Marshalls. It comes in little tins and things like that. So
Mm-hmm.
you're using a whole lot of charcoal. I would probably use it not all the time.
Okay.
You know, I
Okay.
would just switch stuff up.
Okay.
A little bit.
Okay. Um, we're running out of time. This has been very informative.
Good.
A great conversation. Where can people now? Do you practice in town here, or do you like as far as your practice for your hygienist practice? Do you want people
hmm
to look for you there and find you there, or we can leave they can follow you at Oral Health Wellness and
hmm
Learning. That's here on
Yeah,
Instagram, right?
that's on Instagram. That's probably the best way to catch me. At work,
Okay.
it's really challenging for me. If people want to come and be my patients, I can help them with that as well. But definitely the best way to reach me is through Instagram
Okay.
or Health Wellness.
Thank you so much, Kim. This has been I'm really happy with everything that we learned today. Really, it's been a great interview.
Thank you. I appreciate it.
Trying
It's
to
been
find
fun.
it
It's
has
been
been.
fun.
Thanks. I'm sure everyone that I've interviewed, I want to interview again because there are things that I'm sure that we didn't cover. So I'm
hmm
sure that I will in the future come back with you, trying to kind of set things up and work everything out as it goes. But I really enjoyed this. And like I said, everybody want to follow Kim. We can follow her at Oral Health and Wellness Learning. She has the product coming out soon, which is give me the name again, the new toothbrush,
The burst.
the Burst
Burst.
toothbrush. So we're gonna be looking
hmm
for that. We're gonna definitely all promote that. And then also there's a guy here, Sunflower Space Cakes, that's talking about Black Cannabis Week. So please, Sunflower Space Cakes, send us the information. I'd love to be involved and informed about it. Um, and thanks a lot for sharing. Appreciate you. God bless. Thank you, Kim.
Thank you.
All right. Take care.
You too.
All right. And everybody else, I want to thank y'all for joining us again this week. Um, as we always do, go out with my favorite song. It's, it's we got 2 minutes left. Come back next week. Next week we have a very interesting guest. Actually, she's a she's an Instagram influencer. She has a very constructive and she's very funny. Just a great personality. Her name is Tyler Therapy. You can follow her here on Instagram. Look at some of her videos. She's a bad mother puffer. She has a brand mother puffer. So we're gonna definitely keep this thing going, man. I really appreciate everybody coming out. DMV Rice. We about to log off. Please come back next week. Um, we'd love to see you come back next week, DMV Rice. We're and then you can find us on IGTV for any of the older episodes. But we yeah, try Jesus, don't try me. Peace and blessings, everybody. Thank you for coming out. Thank you for joining us. We will see you next week. Remember, you are God.
Peace.